Yeast infection is not sexually transmitted. Please, if you're joining my life, you're welcome. Do wait to subscribe. So some persons they do this mistake. They believe that once they go for this high vaginal swab test and they find out they have yeast infection, they automatically thinks that maybe their partner gave them the yeast infection. You have to understand that yeast infection is not sexually transmitted. Yeast infection is caused by a fungus. And one thing you need to understand that our vagina, we have microorganisms that naturally grows there. Even our guts have microorganisms that naturally grows there. Our mouth have infection is caused by a fungal infection called um, candida. Candida albicans. That's why yeast infection is normally called vaginal candidiasis. Now, vaginal candidiasis grows normally in your VJ, in your vagina as a lady. So don't take it as maybe it's something you contacted somewhere. No. The issue here is that when it overgrows beyond a certain level, it is where the issue comes in. It is where this yeast infection comes in. Now, our body, our vagina, you see bacteria. We have good bacteria, we have normal bacteria. What we group them, what we call them is vaginal flora. Now, for the good bacteria, especially lactobacillus, is found in our vagina. What these bacteria does, they help to maintain the acidic pH of the vagina, because it's supposed to be maintained in a certain level. If the acidic pH of the vagina is not maintained in a septic level, in a certain level, it overgrows. It is where this candida overgrows. So yeast infection is not something you get like anytime you go for test and they say you have candida, or automatically it's your partner that gives it to you. It's not so. So when you have an overgrowth of yeast infection, you should focus more on what triggers the overgrowth of it, the growth, what triggers it to grow more than it should. Now you need to understand that candida being in your body is normal. Is normal. Just like other microorganisms that you can find in our guts. Hello, you're welcome. Chloe, Esther, I can see you. Now you have to understand that you have very beautiful hair. Thank you, thank you. This hair, I don't really maintain it. I just rub cream and come out. I don't really know any product that can help to grow hair, but I normally use shea butter. Once I apply shea butter on my hair, I have water spray. I spray my hair water and just allow it. I don't like manipulating my hair too much. And one thing again is I don't like relaxer. You understand? Not like I cannot use relaxer, or maybe I find I'm that kind of person that sees relaxer as something that damages my like my hair. So I don't like applying relaxer on my hair. So that's how it is, and it's very sometimes it shrinks, so it's stressful to maintain. So most times that I just, if maybe I don't want to braid my hair, I don't feel like braiding hair now, I can just go and weave the hair and just keep it for a week. After a week, I weave it again, or I just style it on my own, just like that. So now, for you ladies that do experience yeast infection, and how can I subscribe? Just click on my profile and just go to my page and subscribe. Thank you so much. Can I send money? Because it's not easy to go live without no one. I'm telling you, it's not easy. Sometimes sometimes you just be talking to yourself like this, and once they come, they run away. It's not easy to go live. You just have to summon up the courage. I thank you so much for keeping me company. Sometimes when you feel like coming live, you just, but of recent, I just want to, to be turning up for my channel. And since I've been turning up, it's something you master. The more you come, you talk, the more you go live. You understand? It's just something you just master. It's not something you just stay one side. If you entertain fear every time, like you feel like you can't do it, you just be like that. But once you just want to make an effort, so the effort I'm trying to make this period is at least in a week I should be coming live, if not 4 times a week. At least I can stay for 1 hour, for 1 hour. And sometimes when my friends are available, we can just go live together and um, collaborate together. So now I'm talking about yeast infection. Most of us ladies experience this. Some persons think that they have never had yeast infection in their life. That is a lie. Oh. Some persons think that once they are not sexually active, that there's no need to run all these tests. Even if you're a virgin, you can still have yeast infection. Even if you have never had sex in your life, you can still have yeast infection. The reason why it's like that is because of your vagina changes, the pH level changes sometimes. You understand? So we should educate people on this. You not being sexually active does not automatically mean that you will not have this infection. You need to understand that there are so many things that triggers it. Yeast infection is not something that is sexually transmitted. This fungus, which is called candida, vaginal candidiasis, caused by a fungus known as Candida albicans, is like a microorganism that lives in our body. Now, it lives in our vagina. You can see it in the vagina, you can see it in the guts, you can see it in our mouth. But you have to understand that this fungus, is not supposed to grow in a certain amount. More than that's why when you go for this culture test or this urinalysis, and some of these tests, if you go for vaginal swab test, they will show you the level of it. Either they say scanty growth, heavy growth, or moderate growth. You understand? Either they show scanty growth, moderate growth, or what they call it, heavy growth. Because this fungus is not supposed to outgrow, it's supposed to be small. So candida is our VJ is its natural habitat. But one thing that triggers it is that if the pH balance there that helps to balance our vagina is disrupted, it grows rapidly. Now we have good bacteria in our VJ. We have bad bacteria. Now for the good bacteria, especially lactose bacillus, what this lactose bacillus does is that it helps to maintain the pH balance in our VJ. Now, you need to understand that one thing that can trigger this candida is misuse of antibiotics. You heard me, misuse of antibiotics. If you are the type that normally take antibiotics, like anything you start swallowing, you can take one card of ampiclox bicham. Anything, you just start taking antibiotics just like that. Without prescription, you would treat typhoid 100 times in a month. You treat what they call a UTI. Some of you even treat UTI without even going for any screening test. you take respiratory infection drugs, just any antibiotic you see, they work for this one, you take it. If they work for this one, you take it. You are causing harm to yourself, because those antibiotic you take, they don't just only target the bad bacteria, they also target the good bacteria. So when you misuse antibiotic, you are killing both the good and bad bacteria. Even if you don't misuse the antibiotic, just know that when you take any form of antibiotic, it doesn't have any specific organism inside, specific bacteria inside of your body. It kills both the good ones and the bad ones. That is why when they give you some certain kind of drugs, they give you a certain kind of milligram and tell you that you should take it so for so days. Thank you for staying. I so much appreciate. If you have any question, you can drop it in the comment below. I so much appreciate. So now, when they give you an antibiotic, when you go to hospital, they give you an antibiotic, they will say take this thing for 5 days, take these drugs for 7 days. And some of you will say doctor doesn't know what they are doing. You will take it more than that. You can ask your question. You are free to ask your question. You can take it more than that. What you are doing is that those antibiotics, they don't have a specific bacteria they target. They target both the good ones in your gut, they target both the bad ones in your gut. So they kill both of them. And when this your body is disrupted, when wound happens in the vagina, is it bad? Like what is it during sexual contacts, like during sexual activities? Is it when the wound happened? You understand? Because wound can't just happen in your vagina without a reason, without a cause. Is it when you and your partner is having any, not just, no, just normal? Okay, like you just wake up and experience wound down there. I just want to be clear. Seriously, it's not normal, please. It's not normal. If you are not sexually active, if you are not, now listening to me, if you are not sexually active and you wake up and see wound in your VJ, inside VJ, is not normal, please. You need to go for checkup. It happens to my friend. It's not normal. It can be a form of infection. If maybe she's sexually active, maybe she and her partner has anything like sexual, it can be that friction, maybe that area was not lubricated enough, or maybe she was not wet enough during the process. That process can cause wound. If you and your partner is about to go down and you are not wet enough, I do not use anything like what they call it, all these lubricants to help lubricate that area, so that there will be no friction. If there's dryness, vaginal dryness during sexual intercourse, it can cause that wound around that area. But if she woke up and see wound, and there was no sexual activities, then it's not normal. You understand? Then it's not normal. And also ask her if she has been experiencing anything like inching. Like there's a way that you be inching so badly around your vulva area, like intense inching, irritation. That irritation can cause redness, it can cause swelling. Sometimes you inch, you don't even know when you inch down there and wound yourself. So if she has been experiencing inching or any form of burning sensation during urination, she should go for some kind of screening test. She can do all these high vaginal swab tests. She can do urine MC, all those kind of tests to know if there's anything wrong in it, around that area. You understand? So that's it. It's not normal, please. It's not normal. Anything you see in your body that maybe you wake up and see any abnormal growth, abnormal wound in your body that is not supposed to be there, you cannot remember you scratching your skin or maybe doing anything that resulted to that wound, then you know that it's not normal. Then go back to what if you have any question, you can still ask. So back to my discussion about yeast infection. One of the things also that causes yeast infection is douching. For those of you that feel that the vagina is not clean enough, you use water There's this thing they normally use. Is it you hold it and put it inside and to wash off your vagina. Dutching disrupts the normal pH down there, the bacteria down there, and when it is disrupted, it can affect your, it can cause yeast to grow. So dutching, misuse of antibiotics can contribute to your yeast growing, overgrowing. You understand? So another thing that can contribute to yeast infection that some persons overlook is tight underwears. When you are the type that you can put on pints for 24 hours in a day, even when you're at home, even when you want to sleep, you still put on pints. What are you putting on pint for? If you're at home, why don't you free yourself, allow air to enter that area? Because you have to understand that moisture, yeast love moisture a lot. So if you are not going out, maybe you want to go for a walk or maybe school activities or anywhere, you can put on your underwears, you can put on your pants. But if you're at home, free that area, allow air to touch that area. It's very, very, see, all these small things help. And if you're the type that buys underwear, don't buy all those ones that air cannot easily penetrate. I think cotton underwear is also nice. So if you wear tight underwear, you put on pants 24 hours a day, no time for it, for breeze to enter there, all those things can contribute to yeast infection because yeast love moisture. If you misuse antibiotics, that one is number one cause of yeast infection. So that's why when you ask some of them, I've treated yeast infection. This message is set for review. Some of them, when you ask them, they will say they have treated yeast infection, they have treated yeast infection. And you ask them what happened, you find out that they have been taking series of antibiotics. They have been taking antibiotics uncontrolled, thinking that antibiotic will automatically save them. Sorry, I can't see your question. It's like YouTube blocked the question. You say the message is head for review. Let me click and see. Okay. Okay, I can see it now, but they did not display it. Say wait when having or period. Okay, if you are using the word this thing X, they normally restrict it in this in YouTube. Wait, when having, okay, like I told you, when we are having intercourse, use the word intercourse, not X, because of YouTube laws. When you're having intercourse with your partner and that area is not well replicated, like the question you asked about your friend that woke up and saw I'm answering the question. I can see it. Your question, if I should read it now, I say wait, when having or period and we had X, what will happen? When is it when on period? I can't get your question clearly. And if you're using the word, don't call X, you can just use intercourse because of YouTube community guideline rules. So what will happen, like if you are having intercourse and that area is not well lubricated and it's not use something like lubricants, it can cause friction, and friction can result to the wound, you maybe can result to wound, you understand, injuries and the rest. So if it's not that area, like your friend does not have anything like intercourse and she just woke up and saw wound that area, I will advise her to go for a screening test, and also ask her maybe if she normally experienced anything like inching around the vulva area, because sometimes you can inch yourself unknowingly, you understand. And if she normally experience intense inching, because when you inch yourself unknowingly for a long period, it can result to redness or swelling which can result to that injury she feels. So for the yeast now, misuse of antibiotics can result to yeast infection because antibiotics kills both the good bacteria and the bad bacteria in your VJ. You understand? So that's why I see some persons who tell you, I've treated yeast infection, I've taken medication, this and that, but the infection is still there. What is wrong? It's not about taking medication, no. And even if you are taking the medication, you shouldn't overtake it. You should take it the way it's prescribed. If they give you 7 days to take your medication, don't extend it to 14 days. Don't extend it to 10 days. Drink like that and stop. Then you can go back and run a test again to know if you have it. So one of the reasons why people have this yeast infection, because some of them will take antifungal medication, they will take antibiotics, they will take this, they will take that, they will combine all of them, and they will tell you that I've drank this, I've drank that, and the yeast is not going. How will the yeast go when you are harming your bacteria, the good bacteria that is supposed to maintain the natural pH down there, the normal pH down there? You are harming those bacteria with antibiotics and you want your yeast infection to go. It's not possible now. You check it out. It's not possible. So another reason that yeast infection grows is hormonal imbalance. If you normally experience recurrent yeast infection, I can put it to you that hormones plays a role also. Pregnancy hormone, if you're on birth control pills, it can cause all those stuff. Hormonal fluctuation during menstrual cycles, all these changes can disrupt the VJ, the pH VJ down there, and can trigger all this yeast infection. Another reason that can cause yeast infection, if you have a poorly controlled blood sugar, maybe you are diabetic, or maybe you are very high on carbs, you take sugary stuff a lot, you drink a lot of sugary food, you eat a lot of sugary food, sorry, all those stuff can contribute to yeast infection because yeast love sugar. In fact, sugar feeds candida. So if you are the type that love eating a lot of sugary stuff, or maybe you have diabetes, you are more prone to yeast infection. Remember, this is an organism that lives down there. So when you feed them on all these things, it can trigger it. So you need to understand that yeast is not a sexually transmitted infection. So when you go for your high vaginal swab test and they tell you that you have yeast infection, you shouldn't have that mindset that it's your partner that gave it to you. You need to understand that candida is a normal microorganism that lives in our VJ. Candida is a normal microorganism, just like we have bacteria that lives in our VJ. We have good bacteria, we have bad bacteria. We have this what they call it, lactobacillus. Lactobacillus is one of the good bacteria, especially that helps to maintain the pH balance in our vagina, in our VJ. Now the vagina has supposed to be in a pH balance of 3.8 to 4.5. So anything that disrupts this pH balance can disrupt the ecosystem there, can disrupt the microorganisms that lives there. That is why yeast can overgrow. This candida can overgrow. So you having candida in your body is not a crime, it's a normal thing. The problem starts when it overgrows, because it's supposed to be in a certain level in your vagina. It's supposed to be in a certain, that's why when you go for some kind of screening test, they will tell you that this thing, you have heavy growth, you have moderate growth, you have scanty growth. This is to tell you that this is supposed to be in a certain level. You understand? When something is scanty, is not an issue. When it's moderate, but when it's heavy growth, so that is why all this candida is supposed to be in a normal, is small quantity. So when you do things that triggers it up and it overgrows, that is where yeast infection comes in. So don't take candida as a sexually transmitted infection. It's a microorganism that lives in your body, just like our gut. Our gastrointestinal system. Some persons don't know that inside our gut there are billions, if I billions of microorganisms that lives there. These microorganisms, we have bacteria that our gut are natural habitats. We have both good bacteria and bad bacteria. We have candida, even candida. You can find candida in our gastrointestinal tract, in our gut. So what all these bacteria and microorganisms do, they help in digestion of food. You understand? They help in digestion of food. They help our system. That is why you see people say take probiotic, take prob. So when you ask them what exactly is probiotic, that's probiotic are those food that help to feed your gut, your good gut, your good bacteria. Probiotic, when you take probiotics, you are helping your all those good bacteria in your gut to help them to function properly, to because when in your gut, when you allow the bad bacteria to overgrow the good bacteria, it causes a lot of issues in our body. Sometimes you see yourself being constipated for long. Food can be in your gut for 7 days, it doesn't move. All these bacteria help to digest our food properly. That is why you see them take probiotics. What do you think that probiotics is doing? Do you think that probiotics is just there to design your body? No, now it's there to feed your good bacteria, to help them to function properly. That is why in the case of what they call it, bacterial vaginosis. In the case of bacterial vaginosis is just like yeast infection, but you have to understand that yeast infection is majorly on fungi, while bacterial vaginosis focuses more on bacterial overgrowth. Even as bacteria is in our body, in our vagina, is not meant to overgrow a certain level. So in yeast infection, there is overgrowth of fungi, while in bacterial vaginosis, there is overgrowth of bad bacteria. Like I told you before, there are millions of microorganisms living in our VJ, living in our guts. They are there naturally. That is their natural habitat. They are not meant to overgrow a certain level. They have their own work. They have their own function. Lactobacillus is a good bacteria in our VJ that helps to maintain the pH balance down there. Our vagina have a pH balance of 3.8 to 4.5. So in bacterial vaginosis, you have to understand that the good bacteria outgrows, the bad bacteria, the bad bacteria outgrows the good bacteria. That is where bacterial vaginosis occurs. Then for the yeast infection, there is overgrowth of candida. So candida is not sexually transmitted. Bacterial vaginosis is not also sexually transmitted. They are not classified as STDs, because STDs are those infections that you can get through vaginal intercourse, anal intercourse, even oral. I don't want to use the word X because of YouTube guidelines. So they mistake all this stuff. Some person mistake UTI, that's urinary tract infection, with yeast infection. They are not the same. You have to understand that UTI, urinary tract infection, are the infection that affects your urinary tract system. UTI are infection that affects your urinary tract system. Now, in your urinary tract system, you get your bladder, you get your urethra, you get your kidneys. So if you have a UTI is something like E. coli. E. coli makes up about 80 to 90% of UTI infection. So your UTI infection affects your bladder. Your bladder is where urine is stored, while your urethra is the tube that carries urine from your bladder to where it is excreted. So UTI, you have E. coli. So you don't mistake UTI with yeast infection. They are not the same. Yeast infection is like a microorganism that lives in your vagina that overgrows, maybe due to several triggers. But antibiotic can trigger, misuse of antibiotic can trigger the growth of yeast infection, because when you take antibiotics, you misuse it, it kills both the good and bad bacteria. When you take antibiotic, it doesn't target a specific bacteria. It kills a wide range of bacteria, and that wide range of bacteria, both good and bad, are there. And when the good ones are killed, remember I told you that good bacteria help to maintain the pH balance, the acidic nature of the vagina, 3.8 to 4.5. If it's not well balanced like that, it will give rise to all these bacteria to grow. You understand? It will give rise to all these fungus to grow. So that is it. If you have any question and you're joining my life, you can just drop it in the comment below. I promise to answer. Then UTI is not the same as STD. STD, you get your HIV, hepatitis, what they call it, gonorrhea. All these are classified as STI, sexually transmitted disease, sexually transmitted infection. You get your chlamydia. Chlamydia is also classified as sexually transmitted infection. If you have not heard of chlamydia, chlamydia is all those kind of chlamydia can be in your body for years without even you knowing, and it can cause pelvic inflammatory disease for women. And when this is caused, it can cause all this can result to scar tissues of the fallopian tube, scar tissues of your reproductive organs. So when you have chlamydia and it's left untreated for years, if you leave chlamydia for years and it's left untreated, it can result to PID, pelvic inflammatory disease. And this PID is one of the leading cause of infertility in women. The reason why it's like this is because it causes scar tissue in your fallopian tubes. It can affect your fallopian tubes. Now, remember that the fallopian tube is where fertilization occurs. When your ovary releases egg, then you have intercourse. It's the sperms swim from your cervix to your uterus. It meets in your fallopian tubes. From your fallopian tube, fertilization occurs, then it swims back to your uterus where it is implanted. Now, it's supposed to slide. Something's supposed to move slightly. It's not supposed to, have any form of friction. So if you have anything like scar tissue there due to infection, because all this pelvic inflammatory disease can cause scar tissue. Inflammation causes a lot in our body. Like inflammation, another word for inflammation is swelling. You understand? So when you have some scar tissue result from gonorrhea, result from chlamydia, result from untreated PID. Thank you for coming back. I seriously appreciate it. And to be honest with you, I did not really get clear picture of your last question, so I don't really know if I answered it properly. If I did not answer it properly, can still drop the question in the comment below. But be mindful of the word you use, because the other one you dropped is like on YouTube. They have their community guideline. They don't allow some certain kind of words. You understand? Like if you use the word X, you can use the word intercourse rather than X. Thank you so much for joining my life. So they even this one you drop again. They did not allow it to show. Okay, when you give birth, will your periods come? Of course now, but some persons do not see their period immediately after childbirth. Some persons, it can take them 3 months, some 6 months, depending on your body. You understand? So women will just give birth this month, and maybe next month or 2 months they start seeing their period. But some persons, it can take them 1 year before they start seeing their period. You understand? But after birth, after birth, you won't start seeing your period immediately because those pregnancy hormones are still there. You understand? Those pregnancy hormones are still there. Your body needs time to reconstruct. Your body needs time for all those hormones to go back to its normal form, because you'll be breastfeeding now. I remember that when you are breastfeeding, your body releases all this prolactin, and all this prolactin is one of the breastfeeding hormones. So all these hormones can prevent you from seeing your period. So that is why you need your body to be in certain kind of form. Like if you give birth, some persons start to see their period in 6 months, some 1 year, some even more than a year. While some, depending on how their body is, they can start to see their period in 2 months. So that is how it is. If you have any question more, you can drop it in the comment below. I so much appreciate you for keeping me company here. It makes my life more like, it makes me enjoy this life more, not to, so that it won't be that lonely. So it depends on your body. So when you give birth, your hormones need to come to be normal. Those pregnancy hormones need to come down before you start seeing your period. So that is how it works. So for the UTI, you need to understand that UTI is the infection of the urinary tract system. For the urinary tract system, you have your bladder, you have urethra, you have your kidneys. So if you have a UTI infection and you leave it untreated for years, I can tell you for sure that it can result to kidney issues, because it is your urinary tract system, right? And the kidney is the organ that helps to filter and also to produce urine. So if you have infection in your bladder, or maybe you get it through your urethra, a bacteria enters your urethra and you didn't left it untreated for years, it can result to kidney issues. So you have to understand the difference between this UTI and STI. Some persons confuse the two, they are not the same. Gonorrhea is classified as as STI, urinary tract infection. Chlamydia is classified as STI. HIV is classified as STI, hepatitis, STI, herpes, STI. So their infection you can get through sexual intercourse. You can get it through vaginal intercourse, anal intercourse, oral intercourse. While for the UTI, remember, UTI is urinary tract infection. So you have your bladder, you have your urethra, you have your kidneys. So your urethra now is the one that is a tube that carries urine out of your body. Now you have to understand that men have longer urethra compared to we women. We have, our urethra is more shorter. That is why we are prone to more infection than compared to men. Now for the women, our urethra is shorter. I think is 4 centimeter. While for men urethra is from 18 centimeter to 20 centimeter. So that is why we women are prone to infection, because our urethra is short. And for men, their urethra carries both urine and sperm. Unlike us, our own is only urine carries. So if you're a lady, you shouldn't allow some of this infection to overgrow, or maybe just allow yourself. You should go at least every 6 months, go and run tests. You can do urine, you can do high vaginal swab tests, you can do urine MC tests or urine culture tests. All these tests help to check if there's any abnormalities or microorganisms that overgrows, or maybe anyone that enters your system, because some of these infections, when left untreated, can result to PID. So PID is not only caused by chlamydia. PID is not only caused by gonorrhea. You understand? All these small infection that affect your vagina, even this cyst infection that affects your vagina, that anything that affects your reproductive organ, near your reproductive organ, can result to infertility if left untreated. because all you have to understand that our systems are connected. Now, if you have PID for years, anything like pelvic inflammatory disease, and you left it untreated, it can cause scar tissue of your fallopian tube, it can cause scar tissues, and this can result to ectopic pregnancy. I made a video on ectopic pregnancy, explaining what causes ectopic pregnancy. You understand? And you don't have to wait till it happens to you, although sometimes the cause is unknown. You have to understand that ectopic pregnancy is on the rise now. It's a tubular pregnancy that occurs in our tubes. You have to understand that this ectopic pregnancy is a life-threatening condition for we women. It's one of the most deadliest pregnancy complications that is life-threatening. Many women have lost their life in an ectopic pregnancy. And when you go to hospital, you ask doctor what can result to ectopic pregnancy, the first thing they tell you is PID, pelvic inflammatory disease. That's one of the first thing they tell you is PID. Now, when you break down PID, you say, how do I get PID? Maybe you are not sexually active. You maybe might even be a virgin before you get married, or maybe you are not promiscuous. How come you have something like PID? I want to put it to you that if you leave any infection untreated, it can result to PID. If you have yeast or this candida infection and you leave it untreated for years, candida does not directly cause infertility, but it can, anything when left for years, it can affect your reproductive system. You understand? So if you have something like E. coli is classified as UTI. If you have all these kind of infections that staph, you left it untreated, it can cause PID, pelvic inflammatory disease. And one thing about PID is that it causes scar tissue in your tube. Our fallopian tube is where fertilization occurs. So when the egg is released from your ovary, it comes to the fallopian tube. Then sperm meets in the fallopian tube where fertilization occurs. Then from the fallopian tube, it is transferred into your womb where implantation occurs. Now that journey is supposed to be smooth. There's not supposed to be friction around that area. You understand? So when you have scar tissue will cause like friction around that area. So sometimes when the egg is fertilized and it's moving, it can't move. It will just go there and implant in your tube. That is the reason why, that is what causes ectopic pregnancy in some women. In some cases, the causes can be unknown. You understand? So one thing about ectopic pregnancy is that once they discover that you have ectopic pregnancy, you are undergoing immediate surgery to remove it. And some women in such process, they can even lose their tube. So it's a sad thing to behold. You understand? If you have not experienced anything like this, you might not really understand what I'm talking about. So women undergo such kind of surgery and they lose their tube. They will tell them that you only have one tube left. And you know that having one tube left as a lady, it decreases your chance of conception. Not like you not conceive. In fact, during a monthly cycle, you only one tube releases egg. Only one tube releases egg. Only one ovary releases egg. Sorry. So you can still conceive having one fallopian tube, but your chances are slim compared to when you have two. So don't think that during your monthly period that is your two, this ovary that releases egg at the same time is one. So that is how it is. So PID can cause ectopic pregnancy, and all these infection when left untreated can cause PID. If you have yeast infection and you left it there, maybe you run this test, you go to any lab, they run you tests and you have candida, please make sure that you treat it properly. In fact, treat it and go back again. Tell them to run that test again to make sure that everything is cleared. Don't just come back home like that and relax. When you run the test and you take your treatment, go back again, let them redo the test to make sure that everything is cleared. Don't just leave yourself like that. So this infection is not sexually transmitted. Understand that it's not sexually transmitted. Candida is a microorganism that you can find in your VJ. You can find microorganisms in your gastrointestinal tract. That is their natural habitat. But you have to understand that it is not supposed to outgrow some certain kind of level. When it outgrows some certain kind of level, that is where yeast infection comes in. So your VJ has a pH, an acidic balance that is supposed to keep this fungus in check. It has good bacteria that helps to maintain the pH, the acidic environment in your VJ. Something like bacteria like lactose bacillus, they work to maintain the acidic nature of your VJ. So if you think your vagina is not acidic, think again. That is why sometimes when you put on pints, if you put on a particular pint for a long period of time, you can see, you will start seeing that pint will start changing color. If you put on, if you observe very well, if you put on something like black pint for long, you start seeing that particular area start coloring white. So your VJ is acidic. It's acidic. If it's not like that, bacteria will just be invading, bad bacteria will just be invading it, and it will cause harm to our body. So this acidic nature of the vagina helps to keep it in check. So when this acidic nature is disrupted, yeast, which is candida, outgrows, overgrows. Now this is where yeast infection comes in. So candida is not a stranger in your body. It is there. If you go and run any test, candida is there in your body. It is not something that is there in your, just like staph. Staph is there in your body, but just that it's not supposed to outgrow some certain kind of level. That is why when you run all these screening tests, they will tell you heavy growth, scanty growth, moderate growth. When you go for any screening test, candida is there, staph is there. You cannot kill the bacteria because it's naturally designed to be there. All you have to do is to prevent all those stuff that can trigger them to outgrow their normal range. So if your acidic or your pH balance there is disrupted the way it's supposed to be, like supposed to be maintained from 3.8 to 4.5, if the acidic nature of your vagina is disrupted, it will give rise to bacteria, bad bacteria to overgrow, fungus to overgrow, candida to overgrow, yeast to overgrow. This is where the infection comes in. So don't think that staph is something that just invade your body. No, it is there. It's a microorganism that lives in your body. So it's normal. It's not sexually transmitted. Some of them will tell you that I got it from the toilet, I got it from like that, I got yeast infection from sitting. No, leave all those talk, my dear. Leave all those talk. Yeast infection, candida. Remember, yeast infection is a vaginal infection. It's also called vaginal candidiasis, caused by a fungus, Candida albicans. So this microorganism lives in your VJ. They live in your gut, but just in a small amount. Just in a small amount. It's not supposed to outgrow that range. It's not supposed to outgrow that range. So that is how it is when it comes to candida. Now you have to understand that when you misuse antibiotic, it can cause an issue to you. That is why you see people saying, I've treated yeast infection, why am I still having this thick cottage cheese discharge. 6, you need to look at the drugs you're taking. They will give you, some of you just, they will give you set of antibiotics, antifungi, be taking. Some of you, they will give you medication of 7 days, that you're supposed to take it 7 days. You say no, 7 days will not be enough. You extend the treatment to 10 days. Some of you will even take double, extend it to 14 days, because you want to clear everything out. It's not done that way. See, as you are clearing out everything out, you are also harming the good bacteria down there. So if doctor give you any prescription of any medication and tells you take it 5 days, don't extend it more than that. Because if you do, you are causing harm to the good and bad bacteria in your gut, in your VJ, and that can disrupt the acidic nature down there. So it's not all about taking medication, it's about taking the right medication and doing the right thing. If you are the type that normally wash your vagina, you think that it's not clean, that you must use water down there. My dear, you don't need to wash your vagina. What are you washing your vagina inside of a vagina? What are you washing your vagina for? Just use my soap and wash outside your vulva. The vagina is self-cleansing. It's not smelly, unless you have infection. It's not smelly. Your vagina only smells when you have infection. You don't need to wash it. You don't need to wash inside. Douching disrupts the natural pH down there. It affects those bacteria that helps to keep the acidic environment of your vagina. So don't need to douch. All you have to do is to wash your vulva. If you are the type that normally use tissue, like anytime you poo, you use tissue to clean your bum bum. In this time and age, why will you use tissue to clean your bum? But you still smell, you can still persist shit now. Use water. If you can maintain all this hygiene, anytime you poo, even if you pee, or less maybe in your public space, you go to work, your school, and the bathroom there is not conducive, then you can use tissue paper. But in such kind of situation, if you have something like wipe, because wipe is a little bit wet, that one is more preferable. But if you're at home, what are you using tissue for now? What are you using tissue? In fact, it's very, very wrong. So use water, clean your butt, clean your ass with water. All this helps to prevent infections. Remember, our urethra, we that are women, our urethra is small shorter compared to men. Men urethra is about 18 centimeter to 20 centimeter, and our own urethra is just 4 centimeter. You see how short it is? So we have to protect ourselves. We are more prone to infection. So that is why even this day and age, you see several cases of infertility in women, and you'll be asking yourself, what is the reason? Is it that our mothers, all these things did not happen? All these things can contribute to it. The food we eat can contribute to it. How we keep our hygiene down there can contribute to it. So yeast love most all this warm and moist environment. If you are the type that put on pint 24 hours, even when you are sleeping, you still wear pints. What are you putting on pint for as a lady? Like you're at home. If maybe you're in an environment where there are guys in your house, then you can just to protect yourself. But if you're at home, like your normal safe space, release that pint, remove that pint, allow air to enter there. Because when you put on pint 24 hours a day, it creates moisture, heat, and one thing about it is it loves that environment to multiply, to grow. So when you wear tight underwear, it's 24 hours you are putting on pint. What is it now? Allow yourself, free that area. So if you're a lady, you normally experience something like intense itching, because one of the symptoms of this yeast infection is intense itching, thick white discharge that looks like cottage cheese. The discharge is not running, because normally we ladies, we discharge, you understand, it's normal thing. Our vagina has smell. The smell is normal, not like when you are smelling something like dead rat, all those stuff. That one is not normal. But when you perceive a vaginal smell, you know that this is a vaginal smell. So if you experience intense itching, redness or swelling around your vulva, or anytime you are urinating, you feel as if there is a burning sensation down there, or you experience cottage cheese discharge, then you should go for test. Do a high vaginal swab test to know if you have this yeast infection, and is treatable. It's not something you stress yourself. This infection is treatable, you understand. It's easy to treat. If you follow the guidelines, it's easy to treat. Don't misuse antibiotics, and don't take drugs that are not prescribed, because when you abuse antibiotics, it harms your good bacteria, and it will even worsen the situation. So you should know the difference between bacterial vaginosis and yeast infection. Now, for yeast infection, the discharge is not that, it doesn't have a strong smelly odor. It have a odor, it has an odor, but not like strong offensive odor. Then for bacterial vaginosis, this discharge is a little bit creamy and greenish, and it has an offensive odor. Now, for bacterial vaginosis is an overgrowth of bad bacteria in your VJ. Like I told you, that the VJ has microorganisms that are living there naturally. We call it vaginal flora. So they are their normal habitat, but just that they are not supposed to overgrow in a certain level. Now, for bacterial vaginosis, the issue is overgrowth of bad bacteria. The bad bacteria increases and overshadow the good bacteria. The good bacteria is less. Now, for yeast infection, there's overgrowth of fungi. There's overgrowth of fungi. So know the difference. And as a lady, you should make it an habit of running tests, going for monthly checkup. At least you can bring out if you don't want to go every 3 months, you can go at least 6 months, or even once in a year. Go for screening tests. Tell them that you want to do all these high vaginal swab tests, urinalysis, urine culture tests, to know if you have any issues, and to treat it on time, because when you treat it on time, you are more safer that way. So that is it. Sorry, let me check something. Channel. Sorry, I was replying. So, yeast infection is not sexually transmitted. You need to get that right. It's not sexually transmitted. It's caused by overgrowth of fungi, and so many reasons can cause fungi to overgrow. I take now is 1 hour. I'll be ending my life.